with this story, Nursing Union Denosa is calling on national government to intervene on the disease outbreak in Hammanskraal. The union says the water crisis is putting additional strain on the area's healthcare system. Simphiwe Gada is Denosa'ss Provincial Chairperson. He joins me now for more on this. Thank you so much for your time, Simphiwe. We do appreciate it. It's a very distressing story. I'm sure you've just heard what the MEC had to say. It seems as though they're trying to get a grip on the situation, but all 37 people that have been admitted are in a critical condition. What is your response as Denosa about this cholera outbreak?
Well, it's quite an unfortunate situation, but as we have released a statement indicating that the national department has got the national government through the National Department of Water and Sanitation has got to intervene because Heidi, we can deal with the situation now, arrest the situation, and everything goes back to normal. But I can guarantee you that we'll still have similar problems. We think that now what we need to do is to go deeper. And the Tshwane, city of Tshwane municipality has got to take accountability because this is not a new issue. Me and you know that the challenges of water in that area have been, an ongoing problem. So we think that there should be an inquiry into the issue so that we know when did the problem start exactly in that area, so that those who are responsible or those who had not taken the proper caution and necessarily care to avert the situation must be held into account, because we're talking people's lives here. Those people who have died, those families must get answers, because this problem has been long coming, and in that area in particular, because the challenge of water there should not take us by surprise. We know that this problem has been there. So that is why we're taking the stance that we're taking, because now what is happening, Heidi, is that the Department of Health in Gauteng is having to spend a lot of money on problems that we could have mitigated against. And these problems are emanating from the municipality. The instability in that municipality is now resulting in what we're experiencing today, because we know that there's been no stable government in that municipality. So these are the consequences of an unstable government in that part of the town. So we think that what should happen is that national government must take over, because we will see the resources of the Gauteng Department of Health being depleted if we do not deal, because what we're doing now is to treat the symptoms rather than treating the real diagnosis of the problem. And we believe as Denosa in Gauteng that the problem in that area is a problem that started a long time ago, and it's a problem that should be addressed. It's a problem that we should deploy resources also from national government so that we can deal with the problem once and for all, because the people of Hammanskraal have been abused, their rights have been trampled upon. And we know that the Human Rights Commission also stepped in to investigate, but we have not seen the Human Rights Commission putting anything on the table as yet. So the people of Hammanskraal really deserve better in a democratic South Africa, and we must then be intentional about pronouncing what the problem is, about investigating the problem, because what is going to happen is that the clinical teams there are going to work over time, and we spend a lot of money on a problem that we know. If the city of Tshwane is failing to provide proper water to the residents of Hammanskraal, they must say so that they can be assisted, because what is happening now is just depleting resources unnecessarily.
Certainly, and I think you touch on a very important point, the fact that this is not a problem that's just emerged. We know about the water issues in Hammanskraal for years. It's not just a new issue that's emerged. I want to ask you what you would like for the health department to do nationally, because we're hearing from the health MEC that they've mobilized Steve Biko Hospital and George Mokari Hospital as well. But the MEC is saying the situation is dire. We already know that our healthcare facilities are stretched and under-resourced. What more, as Denosa, do you want to come out of this? What are you expecting the National Health Department to do?
Well, let's first commend the Gauteng Department of Health for the swift response. Let's commend the MEC that she's there on the ground. She's not relying on reports. Let's commend all the officials and all the clinical teams that have been mobilized to assist with the situation, that they are really living up to the oath of office that they've taken. So we really appreciate that. And we also, as an organization, encourage that our members that they should assist, because here we're talking about human lives. So we will assist, and we're still calling for more health workers that they must assist in the situation, because we're trying to build a nation here, and when there's a crisis, we assist and then we deal with problems later. But what should happen, in answering your question, is that the National Department of Health must appreciate that this problem has been ongoing, and therefore they should give proper support to the Gauteng Department of Health. They should be able to release more resources to the Gauteng Department of Health so that it can be able to respond to the challenges that we are facing. Because in what we have seen happening is that the Department of Health has been under-resourced, has been underfunded. So we are calling that Gauteng is a metropolitan province with the most with a dense population in terms of the citizens, that the Gauteng Department of Health has got to be given more resources so that the department can be able to respond to the issues and the challenges that are facing it. So that's what we want the Department of Health, the National Department of Health, to do. But also, the National Department of Health, in conjunction with the Office of the Presidency, they must be intentional in pronouncing that they should investigate the city of Tshwane and those who are responsible, whether it's the DA government or the ANC government that was heading the municipality. But people should be held to account, because, Heidi, when a situation such as this one arises, it's also a fertile ground for corruption, because the question that we must ask is that who is benefiting from these water tanks that are being deployed and given to people to supply water? Because there are people who are benefiting from this crisis, but also we know that the clinical teams now must move out of the clinical scope of practice. They will be carrying buckets to fetch water for the patients and so forth. And that is not a desirable situation. So there's no way that people can go through such a difficult time, the residents especially, and then nobody is held to account. So we think that the president, through the Department of Water and Sanitation, must intervene in this situation, because this is not cholera. I think we must also classify this issue correctly. This is not cholera. This is gastroenteritis, stomach flu, which is caused by the fact that the municipality is not providing safe water to the residents of Tshwane. And it doesn't just arise that you don't provide safe water. It means that somewhere, somehow, somebody is not doing their job. And these municipality or city of Tshwane must take responsibility and start doing their job correctly, because we're losing lives unnecessarily. I mean, we cannot, 28 years into our democracy, in an era of the fourth industrial revolution, where things have advanced and we still lose water over simple things such as water that must come out of your tap, because the public has placed their trust on the municipality, such that when you open your tap and you can be able to drink water. Now, it's quite scary that now we must revert to drinking bottled water and not drink the tap water, because that's what most of us are doing. And that is not correct in a democratic country where our constitution dictates that the provision of safe drinking water is a right. It's not a privilege to South Africans. So that is why we are raising this issue, to say that we cannot continue in this, in this trajectory. We must address the problem, not the symptoms of the problem.
Certainly. I know you're probably a very busy man tonight, but just lastly, Simphiwe, I just want to ask you one last question. You've basically answered it, but who do you think must take responsibility for this? Should it be the city of Tshwane? Tell me.
Well, it's the city of Tshwane. The city of Tshwane has got to take accountability, because it is their responsibility to provide water. Gauteng provincial government does not provide water to the citizens. It is the municipalities and its entities that must provide this water. So they must take accountability. I was reading a statement of the MMC of Health in the city of Tshwane. Much as I acknowledge and I admire the fact that the two spheres of government are working together, but somebody must take accountability. And in our view is that the city of Tshwane must take accountability in this regard, not only the current administration. That's why we're saying that an inquiry should be opened so that we trace where did the problem start. And those people, even if they are on pension, they must take accountability if they did not exercise the necessary precaution to prevent the problem that we are facing today. So the city of Tshwane must take accountability and must go out to the residents of Hammanskraal and apologize that they are losing now their loved ones because of something that could have been prevented. And now our members find themselves having to go the extra mile, and the Department of Health finds itself having to deploy more resources than what it had anticipated because of negligence from the city of Tshwane.
Certainly. Okay. Thank you so much for your time this evening. We do appreciate it.
Thank you.
As you heard, Simphiwe Gada from Denosa, who is the Gauteng chairperson, speaking about how this is just unacceptable. How can you not be able to drink safe and clean water from your tap? You've had 10 people now dying because of this cholera outbreak, and it remains a huge issue. The health MEC saying that the 37 people that are in hospital are in critical condition. It's just unacceptable. Let's move